Welcome to a comprehensive guide on navigating the complexities of prostate cancer, a condition that significantly impacts men around the globe. This expanded introduction aims to illuminate the fundamental aspects of prostate cancer, underscore the critical role of PSA, prostate-specific antigen measurements, advocate for the necessity of regular checkups, and offer an extensive review of the groundbreaking treatments available as of 2024. Our journey through this topic is designed to equip you with a foundational understanding, paving the way for a deeper exploration of each treatment's nuances. Prostate cancer, a primer. Prostate cancer originates in the prostate gland, a critical component of the male reproductive system. This form of cancer ranks as one of the most prevalent among men, exhibiting a spectrum of aggressiveness. While certain prostate cancers progress slowly, necessitating minimal intervention, others are markedly more aggressive and capable of rapid proliferation. Decoding PSA measurements. PSA, or prostate-specific antigen, is a protein synthesized by both malignant and benign prostate tissues. The PSA test, which measures the protein's concentration in the bloodstream, serves as a pivotal screening tool for prostate cancer. Elevated PSA levels may signal the presence of prostate cancer, though they can also stem from benign prostate enlargement or infections. Thus, while PSA measurements are invaluable, they should not solely determine diagnostic conclusions. The criticality of regular checkups. Consistent screenings and checkups are indispensable for the early detection of prostate cancer, dramatically enhancing the prospects for successful treatment. Although screening guidelines can vary, it's generally advised that men, particularly those at increased risk due to family history or racial predisposition, engage in discussions about screening with their healthcare providers. Navigating the latest treatment innovations. The realm of medical science has witnessed significant advancements in prostate cancer treatment, each offering unique benefits and considerations. Surgical procedures. A radical prostatectomy, the surgical removal of the prostate gland, is frequently employed in the management of early-stage prostate cancer. Radiation therapy. This modality employs potent energy beams to annihilate cancer cells, with recent advancements aiming to enhance tumor targeting and minimize collateral damage. Hormone therapy, ADT. Androgen deprivation therapy works by curtailing testosterone production, thereby inhibiting prostate cancer growth. Chemotherapy, utilized predominantly for advanced stages of prostate cancer. Chemotherapy eradicates rapidly dividing cells, encompassing cancer cells. Immunotherapy. This innovative treatment fortifies the body's immune system to combat cancer cells more effectively. A notable example includes AOH 1996, a pioneering compound underpinned by AI research, which targets the PCNA, proliferating cell nuclear antigen, in cancer cells, showcasing the potential for highly selective and minimally toxic treatments. Targeted drug therapy. This strategy addresses specific cellular anomalies. For instance, the combination of enzalutamide and talazoparib has demonstrated efficacy in certain genetic variants of prostate cancer. Radioligand therapy exemplifies a novel approach that delivers radiation directly to cancer cells, symbolizing renewed hope for individuals with advanced prostate cancer. Each of these treatments comes with its own set of considerations, side effects, and efficacy, contingent upon the cancer's stage and aggressiveness, as well as the patient's general health and preferences. In summary, grasping the essentials of prostate cancer, from early detection strategies like PSA measurements and regular checkups to the exploration of available treatments, is pivotal in navigating this disease. The evolution of treatment modalities offers fresh hope and options for patients, underscoring the value of personalized care and continued research in the battle against prostate cancer. This guide is crafted to empower you with knowledge, fostering informed conversations with healthcare providers to determine the most suitable treatment pathways. Your support is crucial for us to keep producing and sharing valuable public health information. If you find our content helpful, please consider subscribing and giving us a thumbs up. Your engagement helps us to continue our mission.